everyone, Amy Stein from Beyond Basics Physical Therapy here in New York City, and we are doing a video series with Caroline Ball, and it's been a wonderful experience for me, and I hope for everyone that's listening. We really want to spread awareness and increase education in the community in general. There are certain websites that I wanted to mention. pelvicpain.org, which is the International Pelvic Pain Society. You can look there for Find a Provider. Also tell your providers to attend our meeting, which is every October, either in Chicago or a different location. So that's a website that has a Find a Provider. The American Physical Therapy Association, Women's Health Section, as well as Herman and Wallace have a Find a Physical Therapist, a pelvic floor women's health physical therapist. We do treat men as well, and we did do a series with Dr. Rob Graziano in the past. So you could look at our YouTube sites to listen in if you are a friend or a family member is a male patient that has experienced male pelvic pain as well as genital pain that Dr. Rob explains in his video series. As well, there are other sites, the National Vulvodynia Association, the Interstitial Cystitis Association, and Network. They also have a Find a Provider. So hopefully there is someone in your area. If not, then keep searching, because more and more there are more providers that are understanding pelvic pain more, as well as Caroline's experience with endometriosis. So do share my book or video for a chance to win. Share the video series, and you will be eligible for a chance to win. And we are continuing today again with Caroline. Thank you so much again for being here. It's been wonderful having you. And today I want to understand a little bit more of why you ended up deciding on doing the surgery, because some patients with endo, they don't always need the surgery. Many of the patients do. And then what with the surgery, maybe just give a brief of what you did pre and post surgery, just in case the listeners didn't get a chance to listen previously.
Definitely. So I think for me, as I said in one of the earlier series, I had quite a long journey to figuring out what was going on for me. So probably beginning to end, it was over 10 years before, when I started exhibiting symptoms to actually finding out, I have endometriosis. So I think for me, because I've been battling with pain for a while, when I finally had kind of like a medical, there is something wrong, I think in my mind I was like, oh, like in a way, yay, I want to, now take care of this, and if surgery is an option. And obviously I did my diligence to make sure it made sense. But versus, I think if maybe early on in my journey I found out that I had it, maybe I wouldn't have as quickly decided that was the right route to go for me. But, I think for me, because, and as I talked about in one of the other series, because my journey had been kind of long, and by the time I found out I had endometriosis, I had such a great team of specialists, including you and a few others in the New York community where I really trusted their opinion. And I feel like that made it so that kind of getting the opinion of everyone I had been working with to see what made most sense. And, a lot of people, including yourself, were like, here's the pros of surgery, here's, the potential drawbacks. But I think having people I trusted to be able to talk to and think about it, thoughtfully, helped in my decision. And then also, again, having a trusted kind of community in the medical community helped me to find people I could trust to do my surgery. So I ended up being connected by Beyond Basics and also by another one of my doctors to Lawrence Orbach, who was fantastic and ended up doing my surgery. And I think it gave me comfort that he knew everyone I had already been working with, and you guys did a really good job of providing the notes and kind of everything the past few years that I've been doing. So it felt very seamless in the sense that You know, there was just a lot of synergies, and I had a lot of trust that surgery was the right answer. And one of the things I learned in the process is for endometriosis, there's actually 2 different techniques, and maybe more than 2, but in terms of how to do the surgery. And I think, again, having people like Amy who really know the different options was helpful, because my understanding is, so there's what I did was laparoscopic surgery for the endometriosis by excision, where they actually remove, you know, the lesions and where you're having issues, and then the other is
it's more of an ablation where they just like shave off, but they basically just remove more of the top layer. They don't get deep into the tissue, so then what happens is that it grows back.
Yeah.
So excision is the way to go if you are going to do endometriosis surgery.
Which I would have had no idea had I not had, you know, people I already trusted and had a relationship with. So I think for me that was huge. And even actually, I met a woman in the hospital when I was waiting to be discharged, who was there, and she had it was her 4th surgery for endometriosis, and she said her first 2 she had done the ablation, and she said unfortunately there just wasn't as much research back when she did it, and that that can unfortunately, while it might temporarily help, you know, remove some pain and remove it, it then comes back, and then when you have multiple surgeries creates more scar tissue and more issues. So I think for me, having had such a long journey, the benefit, I guess, is that I had a lot of great people I trusted, and felt very confident kind of in the next steps. And I guess, what was your said why surgery? And
you touched on it in previous series about basically going into the surgery prior, you peeled away the layers of onion, and that's how I describe it to patients, and you really took care of yourself prior to surgery and then post-surgery.
So post-surgery, and actually one of the things the surgeon I had said, he said in a weird way, I was almost lucky that it had taken me a while to figure out what was going on, because I've been doing, at this point, physical therapy with Amy for almost 4 years before I had my surgery. And he said a lot of patients, when they find out, you know, they have endometriosis, they're starting from scratch, and they, you know, hadn't been doing that. And so he said the fact I had been doing physical therapy and acupuncture and, you know, other things that helped made it so that I was so strong going into surgery, that it made it so that, you know, I had a better chance for recovering quickly. And so one of the things he said was very important was continuing physical therapy and all the things I was doing post-surgery, because when you have surgery, you, even though it's removing scar tissue that comes with endometriosis, it's creating new scar tissue, the way I understand it. And so physical therapy is still needed and very important to help heal that tissue, so that I could get back to working out and I could get back to all those things I wanted to be doing. And so so I think that was really helpful, and I think really kind of an important piece was continuing, and great for me that I already had that kind of routine. So post-surgery, everyone already knew me, and everyone kind of you know, was so familiar, and so I feel like that really helped me to heal quickly.
Yeah, and if you listen back to the previous series, you'll hear Caroline's whole story and her journey, and how now it was a successful journey. So if there was anything else you wanted to tell patients, what would you say is, you know, anything you can think of?
I guess 2 things. I think one, unfortunately, so much, especially, I mean, I think New York has some of the best resources and doctors, and so I'm so lucky that, you know, Beyond Basics happens to be in the city I'm living in. And I think that a lot of the resources, though, for pelvic pain in New York that you find are very helpful, unfortunately, aren't the things that are like in network, or even the doctors that I ended up seeing that were very helpful. A lot of them are out of pocket. And I guess one of my advice to other patients or people going through pelvic pain is your health is so important, So even in the moment, if it seems like, oh, you know, I should be seeing someone in my network, or pelvic therapy is not in my network, is just to kind of bite the bullet and invest in it now, because you won't regret it. It's your health and long term. And so for me, I think everything I did, I don't regret doing. It was so helpful. And I think a lot of also the Beyond Basics and the doctors will work with you and work with your insurance to try and make it as manageable
as possible.
Mm-hmm. Exactly. So yeah, that would be my advice. And I think physical therapy was so helpful for, you know, I had endometriosis, but I think I've actually referred different friends here and, you know, who have also found it helpful even just for general pelvic pain where there's not even a specific condition. So it's something I definitely recommend to anyone having symptoms.
Great. So as you heard, she had a wonderful healing journey, which is what a lot of patients ask us about, you know, what their experience was with other patients. And Caroline has been great. She's spoken to some of our patients in the past. So if you have any questions, we have a couple patients that are willing to speak to you, male or female. And we have a lot of information on our website, beyondbasicsphysicaltherapy.com. There are other websites as well, as I mentioned earlier in the series, that can help to find a provider, which we have on our website that you could look for. And our social media, again, is at Beyond Basics PT. And we would love for you to share the video series and be eligible for a book, one of my books, Heal Pelvic Pain, or a video, Healing Pelvic and Abdominal Pain. They're also sold on Amazon and on our website, Heal Pelvic Pain. This is now on digital download, which I forgot that a lot of people don't have DVDs and DVD players anymore. So it's finally on digital download. I'm a little slow. And then our Pelvic Health 101 series is offered for free in the fall and spring, and usually it starts in September for the fall, and for the winter spring series it starts in March. So please stay tuned, and we are happy to also answer any questions that you may have if you want to leave us a message on our social media. And thank you so much again. This has been a great experience.
So good to see you, and it's fun to be back as, you know, being able to share a success story with how great you guys have been.
Oh, thank you. And thank you so much. And thank you so much for helping to spread awareness. And it's really great. And everyone listening really appreciates it.
Thanks, Amy.
Take care. Thank you.